Good afternoon, ladies and gentlemen. Welcome to another edition of The Democratic View. With us today is a man who is going to give us more information about something that we have been living with called COVID-19 and the effect of this pandemic. As you can see, I have this on me right now, not as I should. I should have it like this, so that I am covering the nose, correct? Because that's how you protect yourself against COVID-19. So Dr. Michael McDonald is here with us today, and he's going to tell us more about the particular COVID-19 and the effects of this pandemic and what it's doing to our country and maybe around the world.
Great. Well, great to be back again. Thank you.
I gotta breathe.
So the bottom line is right now we don't have a high levels of infection, but we do have, for example, today over 600 confirmed cases in Suffolk County. So it hasn't gone away, but it's much less than the 10, 12,000 that we saw a day in the April timeframe. The problem is that the pandemic is likely to see resurgences. It goes through waves, and then it has resurgences within waves, and then it can have another wave entirely with potentially other mutations. So we've already seen many mutations within the coronavirus family in general, and we're seeing mutations within COVID-19. So we're seeing the emergence of another strain now, which appears to be, there's still scientific discourse to try to figure this out, but it appears as if it might be more infectious, but not as lethal, meaning that it won't kill as many people. Because there is a chain, there's a mutation where one letter out of tens of thousands within its genome has changed, and that's changing the way it manifests in the population. So in terms of illness at this point, we don't have a wave, a resurgence that is overwhelming the healthcare system, which was one of our first big concerns. But what it has done is it's degraded our economy significantly, and it had big effects on our supply chains where we couldn't get certain materials. And because there are collapses now, for example, in New York City, it's expected about 30 to 40% of the small to medium-sized businesses are failing, and the restaurant business especially is being affected. That has rippling effects on other things. So for example, the food pantries, which would get a large portion of their food from restaurants, now have lost that portion of the food chain. And that's expected to get worse out here as we go into the fall and winter.
Gee, I hadn't even thought about that. Wow.
So there's a lot of complications in regards to the pandemic effect beyond just the infection rates and the healthcare system.
And I don't know if you are as aware as I am sometimes that I see the Springs where I live food pantry, and I will see the day that they're giving out the food, the cars lining up.
Absolutely.
And it is amazing.
Yeah.
Absolutely amazing. One time I actually asked a cop on the road, I said, "What's going on over there?" And I thought it was an event of some kind. And he said, "It's a food pantry."
Yeah.
I said, "The food many people? I had never seen that before, and I've been around that area for years, and I never saw it like I have seen it lately.
Yeah, just in the last few months, there's been a doubling effect of the number of people that are now food insecure because they don't have employment, for example. And the monies that have been coming from the government have now been stopped. Hopefully that's going to change again to be able to support people that can't pay for their rent and can't pay for their food and so on. But that's still uncertain.
And as a teacher and, as I said, school administrator, I know that I used to walk around the cafeteria when the children would be having breakfast and lunch,
That's a factor.
I knew, because I did the paperwork, knew that they were getting federal money towards their food.
Yes.
Now, with the schools not functioning, I wonder where are kids getting food from? It's a little scary.
Yes. I'm working with federal agencies now to look at some of these issues, collecting data on what's called the social determinants of health, the factors that most people don't realize are actually increasing the likelihood of disease in certain populations. What we're finding is that in Black and Hispanic populations, for example, they have a much higher rate of COVID-19. Not because necessarily biologically they have any difference, although there are comorbidities in different populations, meaning that there are other diseases that make it more likely that you'd have severe illness with COVID-19. But they have factors like living in housing that where lots of people are living in very close space, for example. Or they're food insecure, which makes them more susceptible to disease, that kind of thing. And we do have populations out here.
Yes, I do. As you're speaking, I'm thinking of places and houses I pass where I can see 5 and 6 cars.
Yeah.
And I know that that's a house full with, that's probably pretty crowded.
Yeah.
And not as safe, and it's scary. It's a little scary.
Well, in our hamlets, we saw pretty high rates of infection in those types of populations during the past several months. But there are ways that we can reduce those effects, and that's something we have to consider. But first, we have to understand the social determinants of health. We have to be able to measure it so that we can actually correct it, and that's part of what we're doing, for example, through the East End Resilience Network and the Resilient American Communities Initiative.
So let us say that I live in a household with a few people living with me, a few adults. Should we be wearing masks in the house?
Definitely.
Yes?
Yeah, well, it depends. If people are coming back from
work.
Yeah, whatever, and they're coming back into the home, and if they feel like they actually are exposed or likely exposed, then you would want to be able to keep social distance. If you can't keep social distance, then you actually should be using cover. But if you know that the other people that are coming into the home have not been exposed, they also have been keeping physical distance, and they've been wearing masks in areas where they might be infected, then that shouldn't be a problem. You shouldn't have to wear masks in the home.
So if someone is, let's say, going to pick up dinner somewhere, they should make sure that they have the mask on.
Definitely.
Covering up their face.
In super transmission sites, yes.
And what about gloves? Should they wear gloves too?
Well, not necessarily, but if, for example, you're bringing a material into the household and you don't know whether it has been infected or not, and you're high risk, then I think that there is, you may want to be using gloves to handle the materials. And we did that a lot in the beginning of the pandemic.
Yes.
But we know that the main transmission is through airborne transmission. And we know that if somebody is actually coughing or speaking or singing, the likelihood of transmission is higher. But in the normal circumstance within the home, you're not going to have to wear masks. But going into supertransmission sites or coming back, that would be a factor. And if you're bringing materials in. So for example, the New Zealand had, I think, over 100 days of no cases at all after a wave, a surge. And now they have new cases. And the cases came in apparently through refrigerated materials from the United States. And China also had the same issue of chicken coming in that was frozen into China from Brazil. So there are what's called fomites. The virus is on material that comes into the home, and then if you're not really washing your hands well, you're not washing the materials that might be infected, then there is the possibility of transmission with your hands touching your face, for example.
I want to ask also about the disease itself. It seems to me that, as I have recently read, it's far more complex than I originally thought. I thought that you got it, you either survived or you died. But it also seems that even if you survive, you can have long-term effects in your body. Is that correct?
Yes. So we know that it's not just a respiratory illness, for example. It also affects the circulatory system. And so there are aspects of our anatomy and physiology that are affected for the longer term. And there are cases that actually will have symptoms that go for months, which is unusual. Those are the outliers, but that can be the case. If you're older, for example, it's more likely that you get severe illness and it would last longer. If you have comorbidities because of heart disease or diabetes or obesity, those are factors that would potentially elongate the clinical illness. But in most cases, people will clear within about 14 days. However, not only is there potential complications within certain risk groups for their illness as an individual, but the pandemic effects on specific communities can be devastating to their economy and eroding their social infrastructure, their food supply, their supply chains, and so on, their employment. And in some cases, in the upcoming months, we're expecting those pandemic effects, the cascading effects, to be potentially pretty severe in some communities, more so than people realize. The government may not be able to come over the hill and solve all the problems in all neighborhoods if this goes on for months and months. And at this point, we have no vaccine, although we have a lot of work being done on vaccines. It's uncertain whether those vaccines are going to be safe and if they're going to be effective. The Russians have now released for testing their vaccine, and actually Mexico is going to be doing some of the testing with that vaccine very soon. But the US system of ensuring the safety of the vaccine would mean that it's unlikely to be available for most people during 2020. It would be into 2021. And in discussions with infectious disease docs about the vaccines that are coming down the pike, they're still skeptical that it is going to provide long-term immunity. So this pandemic will be around most likely to 2021, and other mutations may, again, create other waves of the virus that could last for much longer than we would want.
Wow. Wow. That's pretty frightening, to tell you the truth. I mean, it's, I think we all kind of hoped that, you know, this surge would dissipate and then we would be able to go on with, without having this prevalent disease around all the time. But it doesn't look like that's really going to happen for a while.
Well, I've been coordinating the Florida Disaster Resilience Initiative for the past few years, and we have pilots now going on from federal agencies on COVID in some of the communities and counties that we've been working in Florida to look at some of the impacts, to gather good data on the social determinants of health. And what we're finding is that in some of the communities that got hit by hurricanes, for example, in Bay County, by a Cat 5 or hurricane, like Hurricane Michael, they're already devastated. And now they've got this pandemic effect on top of it. And if they get hit again, what are you going to do in terms of shelters for people who are already have very marginal housing? But let's just say for out here in East Hampton, if we got hit by a Cat 5 and it let's say there's 400 households that can't live in their house right now because the roof's been ripped off. How are you going to shelter those people during the pandemic if we get another surge? So there are these complications that are difficult, a lot of complexity.
And not only that, but we also are entering what we call the hurricane season. And that could be another burden to our lives where we don't have power. And you know, how do you get water to wash the hands all the time and keep the surfaces clean? And so it's pretty tough.
Yeah, if there is a scenario that the children are back in school, that the schools are super transmission sites, so the infection rates go up, then we close the schools, but we get hit by a hurricane when the COVID-19 incidence is higher. So those are the kinds of things that we have to think ahead about.
And that COVID-19 as well, one of the things that I kind of mentioned to you before was that it's a far more complex disease than I originally thought it was.
Yes.
It seems to be, you know, I thought it just killed you and then, or you got it and you survived and you were okay.
Yeah. But even for people who are asymptomatic, they're seeing that they actually have changes in their physiology which may make them more susceptible to other diseases later on. So for example, herpes can end up as shingles. If you have herpes when you're 20, it could end up giving you very severe shingles, which could kill you in your 70s, for example.
So if you have the shingles vaccines, does it help?
Definitely, yeah.
So we should be getting vaccines. And
yes, but on the vaccines, let's look at the COVID-19 vaccines now. There are several vaccines, and they're working hard on it, and hopefully we will have a vaccine. But it's going to be into 2021 before there's going to be wide distribution of the vaccines, most likely. And even if we have the vaccine, for example, if it's like the cholera vaccine was like 50 to 60% effective. So we might vaccinate the population, but we haven't reached herd immunity. So we still have, in this case, the virus moving through the population because we haven't achieved what we need to achieve with herd immunity.
It's really, it really boggles the mind. It really does. It's like, oh my God, I think I'm just going to stay in my bedroom for the rest of my life.
Well,
I mean, because it sounds so complicated.
so then there's the mental health impacts.
Yes, and true.
For example, and then there's also the breakdown of trust in institutions because people are not able to get the supplies they need on time. Their employment begins to erode. It might be that the banks won't be able to provide loans under certain circumstances. The government may not be able to provide the unemployment. So there are all these other factors that begin to degrade the social infrastructure, and that's what we've got to worry about.
Yes, yes.
And one thing that I'd like us to think about is, can it really go back in the box? Are we talking about just going back to the way things were, 6 months ago? Or will we have to innovate and figure out how to do this better going forward? How do we reorganize some of what we do in our communities, given the fact that the virus may continue through mutations and so on?
Wow, that is, so we may never be the same as we were before this whole thing started.
I think that the chance of us having changes in our political economy is probably likely. Right now, for example, if you just look at the polls, for example, it's possible that we will have a change of administration, for example, with very different kinds of policies. But maybe even if there is a change of administration, it may be that they're not thinking about how to go forward. They're thinking about how to have it go back the way it was. And if it's not feasible to, for example, have slaughterhouses, for example, that are functioning in a healthy way, where everything's concentrated in these huge slaughterhouses, we have to go to new approaches where we may have to be raising animals more locally, where we can contain the infections in smaller slaughterhouses, or move more toward more vegetarian meals, where we're not consuming as much meat. So there's those kinds of things that may shift as time goes on.
This is extremely far-reaching, isn't it? Much more than I think most people realize. They don't realize that this could change our lives.
So one of the things that we've done is we've applied for grants with the National Science Foundation, for example, and the Rockefeller Foundation, data.org, to look at how we would do games, where we would do simulations of how the community understands the threats of these kinds of changes, pandemic effects, not just the infection, but changes in supply chains and the bankruptcies within vital businesses and so on. So for example, what if the people in power plants that control power plants, there's very few trained people to work the control rooms. If they infect each other and those vital workers are not able to maintain that power plant, that's going to affect the electrical system, for example.
Oh, wow. Wow. Yeah.
But you can go to more distributed systems. And Connecticut, for example, is doing that after this last tropical storm because they had a lot of blackouts. They realized that these very large monopoly utilities are actually making them more vulnerable. So there are most likely going to be changes in the social infrastructure coming out of the pandemic or in the latter stages of the pandemic.
Dr. McDonald, I must tell you, you have certainly given us an awful lot to think about. Not only how to keep ourselves safe, but also how to and what to expect from our own future. I mean, we have a lot to deal with here. This is a complex scenario that you have presented to us, and holy mackerel, I hope we're up to it. I hope we're able to do the kind of things that you have been talking about so that we can protect our areas, our civilization, our country, or whatever, you know, because this is complex.
Well, the good news is the Bucolic bioregion is more likely to be able to face the pandemic effects and the climate change effects, for example, than other places. We have less dense population, but we may have 2 to 3 times the population this winter than we normally do, and it's unclear how we're going to manage that yet. For example, we're not producing food during the winter here. We don't have the capacity to do that yet. Maybe that's something that we have to think through. So that's why we're doing these simulations and setting up pilots here and in 400 sites around the world to look at how are we going to manage this potential large shift, and may require a new type of political economy to manage the changes that are taking place.
Well, one of the things I think we have to start thinking about all of these things that you have told us. And I can only say thank you very, very much for coming and telling us all these things. Well, I must say, I feel like I've had an awful lot of information here that I really have to start. I'm already thinking about putting up tomatoes.
Yes, definitely. You know. Having food security is a crucial part of this.
I got plenty of those. Wow. Thank you very much.